sometimes what maximizes profits doesn't maximize healthcare. And I think that's a pretty safe statement to make, right? Whereas when you're on the other side of it and you're both a practitioner and a business owner, you're making decisions sometimes based on your values and ethics that are counter to profit, right? And that's a choice you can make when you own your own practice.
3, 2, 1. Liftoff.
Welcome back to the Ketamine Startup Podcast. I'm Kimberly Coe, and this is where we talk about building a ketamine therapy practice, industry insights, and what's shaping the future of psychedelic medicine. Today, we have a conversation about career reinvention, ethical practice building, and what it means to choose purpose over profit. My co-host, Sam Coe, is joined by Dr. Marc Smith, founder of Clear Ketamine and Psychiatry in Westlake Village, California. Dr. Smith's journey is remarkable. After working 3 years in the finance industry, doing hedge fund trading and sales in New York, he made the bold decision to completely pivot his career path towards medicine. He completed his medical degree at Columbia University, did his psychiatry residency at USC, and now runs his own private practice combining ketamine-assisted therapy with traditional psychiatry. You'll hear about Dr. Smith's insights about the growing mental health crisis, why private practice autonomy matters, and how ketamine works as a catalyst rather than a cure in itself. The conversation also covers practical advice for providers considering their own practice, the importance of ethical standards in this field, and why connecting with others who've made the same leap can help you avoid costly mistakes. But before we jump in, a quick reminder. The information shared in this episode is for educational purposes only and does not constitute medical or legal advice. Treatment approaches discussed should be evaluated with your specific practice context and regulatory environment. Now let's dive in this conversation with Dr. Marc Smith.
I am super excited to have Dr. Marc Smith on for today's podcast episode. Welcome to the show, Marc.
Thank you for having me, Sam. It's really exciting to be here, and it's always a pleasure to see you.
Thank you. Let's start at the beginning. So for the people who are listening and watching who may not know you, tell us about your background and who you are.
Yeah, thanks. So, man, where do I start? I'm originally from the East Coast, so I'm from Boston, Massachusetts area, small suburb. And my path to medicine, into psychiatry, into ketamine therapy is quite circuitous. So I, believe it or not, I had a whole other career, a whole other life prior to going into medicine. I actually worked in the financial industry in New York right after college. Went to college for business, for finance. And so worked in a couple different jobs. One was at a hedge fund doing trading. One was in sales, and just didn't quite have that career fulfillment, satisfaction, mission, purpose that I was looking for. So ultimately, after a long series of deliberations, soul searching, decided I wanted to be a doctor, which probably was the hardest and longest path I could have chosen, but also the most meaningful, right? So went to something called a post-bac pre-med program, which for anyone that doesn't know what that is, it's so that you can study and get all of the prerequisites to go to medical school. And then, so that took about 2 years while working in New York, then applied to medical school, got in, did medical school at Columbia University in New York. And during that time, I did not know that I wanted to go into psychiatry at first. I knew I wanted to be a doctor. I wanted to be part of the healing profession. But really in doing the clinical rotations, so how med school works for anyone that doesn't know is a lot of the first part of it is classroom learning about biology, learning about pathophysiology from a mechanistic and kind of more scientific standpoint. And then generally the second half is clinical rotations. And so doing the first half, I learned about the brain and psychiatry and the different disorders. But it wasn't until that second half of med school, the clinical rotations, that I really understood what it was like to work in each type of specialty, right? So You go from everything to pediatrics, to primary care, to surgery, to OBGYN, and all the other specialties and subspecialties. And what I found when I was doing the psychiatric rotation is not only did I find the connection between the brain and emotion and cognition extremely fascinating, but you really got to develop relationships with people on a deeper level, in my opinion, a different level, but in my opinion, a more deep and intimate and really thorough level in psychiatry than a lot of the other specialties. So I loved that about it. I loved getting to know people in and out, you know, on, and so, that's ultimately what I went into. So that's kind of the decision tree. You apply to a residency. I applied to residency out here in California. My family had all relocated to California, and I was, after living in New York City for 10 years, ready for a change and some sunny weather. So came to LA, did residency at USC. And then during that time, I obviously got a lot of exposure to psychiatry, right? Depression, anxiety, PTSD, OCD, and all the different settings. So everything from inpatient, where people are in the hospital, really acute, suicidal, a lot of really severe mental illness, to less severe and outpatient, right? And everything from kids to adults. And we saw a lot of different types of patients, right? So, of course, I'm a doctor. I'm a psychiatrist, right? I've seen the benefit that medications, specifically SSRIs and other medications for depression, can have. But there is a large percentage of people that don't benefit from medications, right? So, it's I was always kind of curious about them, right? And felt compelled to try to find something that would help them, right? So I learned, it was an interesting time when I was in residency, right? Because there was a lot of new treatments coming available, right? So things like TMS, which is a interventional treatment for depression, and things like ketamine, right? So newer, different mechanisms to treat that large percentage of people that don't benefit from medications, right? So about 30% of people with major depressive disorder don't respond adequately to at least two or more antidepressant trials, right? And that's what we call treatment resistant depression. And so we'll get into this, I'm sure, in great depth, and I'm sure your listeners are already interested in it. But ketamine is one of those treatments, right? It acts at a different mechanism than traditional antidepressants, and it can have a lot of benefits, right? Both to treat the people that antidepressants don't work for, as well as rapid acting antidepressant effects, and among other benefits. So during residency, I kind of geared toward these interventional treatments in addition to the more traditional treatments. And then when I got out of residency, I joined a large private practice, which focused on those, right? So we did medications, we did TMS, we did ketamine treatments, we did Spravato treatments, esketamine treatments, which we can talk about if you like. It's just another form of ketamine. And so I loved having more tools in the toolbox, right? And that's what I always talk to people about when I talk about medications and ketamine and even lifestyle and therapy. They're all tools in the toolbox to attack the issue, right? And sometimes different tools are needed for different jobs, right? And ketamine is just one of them. And so is therapy, so is exercise, So, but I loved having more tools because it gives a better chance of success, right? So you can interrupt me. I know I'm going
Yeah,
on and on.
actually, I wanted to
Please.
double click on something, and this is,
Sure.
you mentioned this at the beginning, and one of the things I find fascinating about your story, Mark, is you already, prior to starting medicine, like you had a career. You were in the finance industry. You were probably moving your way up and climbing that ladder. Uh, just to clarify, how many years did you do that prior to starting medical school?
3 years.
3 years. So you were doing, sounds like investments and hedge funds and valuations and spreadsheets. I think it's inspiring that you actually had a career, you were going down a pathway, and then you said, "Hey, time out. I'm going to take a, reassess what I want to do and make a quite a dramatic shift." So number one, I applaud you for that. And I think it's really cool how you took the leap. And I've seen you take the leap in multiple ways, whether that's launching your own practice or stepping away from finance. It's quite impressive, Mark. So thank you for sharing that piece.
Yeah, well, thank you. It's like it's funny to be in this position and think back. It seems like another lifetime ago. But what I can say about that is, we only have one life to live, right? And we all have to live with purpose. And I I was really compelled to live a life of purpose, right? And it's I look at it kind of not to be too lofty or anything, but I look at life kind of. I think we had talked about this, right? Like we start with a big marble, right? And we just chisel away at that marble as we go of what we aren't till we get to more of what we are, right? And that was a big, that was a huge chunk for me taking that out of that marble. But even so, as I was kind of detailing, uh, as you go, so I knew I wanted to be a doctor, and then I knew I wanted to do psychiatry, and then I knew I wanted to do interventional treatments, and then I knew I wanted to do ketamine assisted therapy, and then I knew I wanted to start my own practice doing that, and we just keep going like that. I think forever.
Yeah. Yeah. I
Yeah.
mean, it's a nonstop process where we're continually chiseling away at the marble statue and becoming who we are. And maybe this is and we're getting loftier, but maybe this is the point in a way of blossoming or becoming the full human being that we're meant to be. It reminds me of like Abraham Maslow and the pyramid and the hierarchy of needs, and it reminds me of like someone reaching self-actualization, which may just be a continual dynamic process, but for and not everyone can get there. I mean, that's the thing, because they may need to meet those lower hierarchical needs. But yeah, I think we're very fortunate to be able to go for that goal of self-actualization and becoming the best version of who we are.
Yeah. Yeah. And you said something in there about being fortunate, right? And
Yes.
I just feel incredible gratitude. And I speak to my patients about this, right? That is a perspective that I try to cultivate every day, right? Just how the position of responsibility and what a gift it is for me to be able to have a career that I can, it's very cliche to say, but help people, right? That I can be of service to people and see people's lives change and improve. And, uh, you know, with especially things like depression and that is a debilitating illness, and to see people change and with the tools we get to use and the job that I get to have, I'm just incredibly grateful for that position that I get, the work that I get to do.
Yeah, totally.
And I know you feel the same way.
Absolutely. I'm curious. So you went to USC for residency, which is, a
Mhm.
world renowned institution. I mean, it has the prestige, it's very cutting edge. And, given that you're a psychiatrist, like what was, before you started up your practice, what was the vibe or the consensus amongst psychiatry and maybe the attendings when you were in residency? Like, were they open to IV ketamine? And this is probably before there was S-ketamine available. So, what was there resistance there, or was it like, yeah, this is cutting edge, we're into it, from the community of academics in residency?
That's a good question. Yeah. So when I was in residency, people were pretty excited about it. And that was the impression that I got, and the culture of at least the environment that I was in. Um, you know, the, Similar to psychedelics now, right? Like there's a lot of excitement and uh, 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 potential that people see in that, and there was still an appropriate amount of trepidation, though, right? Cautiousness, which is important. But specifically with ketamine, really the research was a little bit more robust, even at that stage, than with psychedelics, right? Simply because it is an FDA approved medication for not for psychiatry, yeah, IV ketamine, not for psychiatry yet, but so it was easier to used in studies than things like psychedelics, right? But yeah, I think basically because it's not a secret that there's a need, right? That need for treatment resistant depression, and people have been looking for that for a long time, right? In a lot of different possibilities. So yeah, I mean, the other side of that though is that as everybody knows in medicine, from when the research is there, or even sometimes when it's FDA approved, it takes a long time for it to get into general practice, right? And people can be excited about something, but just the wheels of change move slowly, right? And you have to develop protocols, right? You have to develop business models. You have to develop safety protocols, patient care protocols, and that takes a while, right? And I think you can attest to this, and a lot of your guests and listeners probably know. Even now, we're still in that process of making ketamine treatment widely available. It's still not widely available yet. It's getting there, but not quite. We're still working those kinks out, I think.
Yeah, there was an interesting, I believe it was published in JAMA, Journal of the American Medical Association, where they found on average it took 17 years for something, once the research has been proven or has been performed, for it to actually be put into clinical practice. And medicine is slow to change. I remember I either learned it or read it during med school. They said science changes one funeral at a time. So
Mm.
people will get stuck. Some people will get stuck in their mindsets or beliefs, and it's like a lot of people have a hard time changing their mindset, and then it only changes once they pass away, and then it's like, all right, there's a new generation of physicians. So yeah,
Mhm.
it's really fascinating how the medicine wheel turns quite slowly, even when there is evidence.
Yeah, I agree with you, and that's what, not to turn around on you, but I think is really cool about what you do, right? And that's a big part of what you do is you're kind of bringing that exponentially. Helping ketamine treatments in a safe and ethical way get to people exponentially by assisting and giving information and really evidence-based ethical information on how to set up ketamine treatments, how to expand access to it. And I think that's really important. So
Thank you. Thank
kudos
you
to
for
you. Yeah.
thank you for that. I would love to hear your perspective and hypothesis. And you may or may not have an answer to this, but you have so much experience in the psychiatric field, Mark. Um, well, what are your thoughts? Like, why is there an increase in mental health challenges, whether that's increases in depression, anxiety, PTSD, suicidal ideation, actual suicides? Like, what's your hypothesis? And we may or may not have an answer, but I'd love to hear you opine on this.
Yeah. Yeah. It's a big question, right? And there are a lot of theories, and it's been talked about a lot. And I can tell you kind of my opinion and anecdotal evidence,
Sure.
but I try to be as evidence based as possible as I can. And I think the answer to this question, I don't think there's any randomized controlled trials or meta analyses that can answer it. But, I think we can all understand living in this new world, the challenges, right? I think a big one is social isolation, right? It's a huge one. Um, eh, People have less community than ever, right? There's our work, our nuclear families, but things are getting more and more online. These these systems that we used to have for in-person and community connection are not as widely accessible as they used to be. I think that's a huge one, right? And you can see it. People feel isolated, right? People don't feel connected. I think that's a big one. The As everybody, a huge part of that is technology, right? And this has been talked about at great length. But how it's kind of making our lives less healthy. We talk about different lifestyle treatments for depression, right? So I work on the biopsychosocial model, right? We have biological elements of mental health, we have psychological elements of mental health, and we have social elements of mental health. And some of the lifestyle things we all know to be beneficial are, I always say, exercise is one of the best antidepressants, sleep, right? Connecting with nature, having social supports, right? Eating a healthy diet. Oddly, these things seem to be more difficult to do as our demand, our attention, the attention economy, our attention is being pulled away at all times. Whether it's our phone, our work, we're more efficient. We have texts popping up at all time. So we oddly don't have as much connection to these mental health lifestyle choices as we used to. And I don't have solid evidence for that, but that's my opinion. And so those are some of the reasons why I think there's also like I said before, a lack of access and ability for people to navigate the mental health system. It's very difficult, surprisingly, to find a psychiatrist or a nurse practitioner, a prescriber. People don't know how to navigate that, and I don't think it's their own fault. I think it's very difficult. I think there's not as much access as we talked about to interventional treatments, like you like we had talked about, whether that's TMS or ketamine treatments or even Spravato treatments. Yeah, I think there's a lot of reasons.
Yeah. Thank you.
I don't, unfortunately, I don't have all the answers to
Yeah,
those.
it's a big question, and I appreciate you taking a go at it. So what I'm hearing is, we have increasing technology, more social isolation, and then also the lack of access for mental health. And I agree with you. It seems like mental health, in a way, you know, it's just challenging. Maybe it's because it's like an invisible thing. There's not necessarily like, oh yeah, we're gonna do a spinal tap and get your serotonin, dopamine, glutamate levels or various neurotransmitters, and now you have a diagnosis. It's a subjective experience for an individual, and we can see the ramifications. Where they may not be getting out of bed, or they may not be going to work, or they may not be brushing their teeth. I mean, these are the physical actions. But yeah, it seems like, if someone has a broken bone, it's like, yep, we can take an x-ray. There's a comminuted fracture. We're going to do X, Y, and Z for it and put in some pins and screws. Like, it's very clearly seen, I guess, in a way, versus something that's, quote, like invisible.
Yeah. Yeah. And psychiatry is you have to have tolerance of complexity and ambiguity and shades of gray, right? And that's something that's real challenging and that I love about it, right? Because humans are very complex. Uh, Emotion is very complex, right? And so, these states of depression, anxiety, trauma, they're very complex, and they have there isn't a lab you can do to diagnose it, and there isn't a lab you can do to treat it. You can't track treatment of it. It by nature has some subjectivity, right? We try to make it as objective as we can with these scales that we take, like the PHQ-9 and the GAD-7 and things like that. But at the end of the day, people don't fit neatly into the DSM-5, right? And your experience doesn't fit neatly into the criteria of depression or anxiety or one thing or the other. So I think we have to have treatment geared toward that reality, right? So that's kind of something that's one of the reasons why I actually started my own practice was that I found in the medical model, the insurance based, like private equity practice medical model, it's, there's reasons for this and understandable reasons, but it's not, it doesn't leave as much room for um, kind of complexity in getting to know a whole person and taking time and addressing root causes and addressing things outside of just medication, dosing, you know, changing the dose, doing a PHQ-9 and treating to that, and then moving to the next one, right? So I really, in starting my own practice, that was a huge core value for me was holistic care, getting to know people individually and spending time to address causes other than medication.
Yeah.
Yes, I am a psychiatrist. I'm not giving up my prescription pad, but I think it's of crucial importance to address that complexity of each person.
Yeah. And what's really cool, Mark, is that, I just realized this as you were speaking, and our conversation about you actually being in the finance industry previous to starting medical school. And then now, you're mentioning, private equity is entering the healthcare space. So you kind of have this unique perspective in a way of like, yeah, crunching the numbers and seeing these valuations and maximizing profit during your, once you finish college and entering the finance world. And then now you're kind of seeing it from the physician, medical clinician perspective. So I would love to hear you talk about that and like having kind of, having had experience on both sides of the finance world and the medical world.
Yeah, well, I mean, it's such an interesting. Yeah, I think about this a lot actually, and it's such an interesting topic because being a private practice small business owner, there is in this country, medicine is a capitalistic market, right? So, um, in private equity, particularly when they make an investment, they want a return, and that's completely understandable given the structure of the business market. But that isn't always the incentives for that aren't always aligned for the benefit of the patients or the practitioners, right? So sometimes what maximizes profits doesn't maximize healthcare. And I think that's a pretty safe statement to make, right? Whereas when you're on the other side of it and you're both a practitioner and a business owner, you're making decisions sometimes based on your values and ethics that are counter to uh, profit, right? And that's a choice you can make when you own your own practice. And I'm grateful for that choice because I get to decide personally that I don't necessarily want to be all about profit. And it's a weird thing to say owning a business, but if I wanted to make it all about profit and money, I would have stayed in the financial industry, right? And so I don't control the economic structure of the medical industry, but I can make my own choices within that, right? And so I personally choose not to participate as an employee of a private equity firm and kind of similar to yourself, go a little radical in terms of on my own, hanging a shingle, starting a private practice and doing things the way that I believe in and want to do it. And there's certainly a trade-off to that, right? You take risks, you have to do things that are not usual doctor responsibilities, like design an office, get someone to build a website for you, uh, get insurance, all sorts of different things. But, for me, it's been such a learning experience, such a valuable experience. And the fact I got into this to make a difference, right?
Right.
And to treat people. And so I get to do that. And again, I'm super grateful about that. And again, I know I said it before, but for you to be able to assist people in doing that for themselves is a great gift, and I hope you feel that as well.
Thank you. Thank you, Mark.
Okay.
I love how you highlighted the autonomy that one gets as they build a private practice because yeah, we can make decisions that are not just about the, profit maximization. Um, so when I was in grad school, I was in an MD MBA program, so it was like a
Mhm.
combined joint 5-year program, so I was able to reduce it by 1 year. And I remember sitting in B school and they were teaching us that the goal of a business, they clearly highlighted. They said profit maximization. That is the goal of a business. And what you just said is, sometimes that goal doesn't align with healthcare in a way. It's
Mhm.
it's not just about profit maximization, and sometimes we have to make choices that doesn't necessarily maximize profit, but it's still the right thing to do. And when we own our own practice, we have the optionality to do that. Whereas when we're an employee, because of various incentives, that's more challenging to do.
Mhm. Yep. Exactly. Exactly. So, yes, it's an interesting world we live in.
Hey, listeners, this is Kim, and I just want to acknowledge that you're here for a reason. Maybe you're stuck in a cycle of long shifts, feeling a little burnt out, and wondering if there's any other way to practice medicine, especially on your own terms. We've been there, and that's exactly why we created this free checklist, your step-by-step roadmap to starting a ketamine clinic without those costly mistakes. Grab your copy now at www.ketaminestartup.com/checklist. It's completely free because we want you to succeed, not struggle. And hey, if you're driving or mid-workout, don't sweat it. Just check out the show notes for the link when you're ready. And again, that's www.ketaminestartup.com/checklist. Now let's get back to the episode.
I want to shift gears, Mark. I want to hear about your practice. So
Sure.
tell us about clear ketamine and psychiatry. And in particular, like, every physician, clinician has their own practice style. It's a bit different. I think about this as the art of medicine. I mean, we may be using the same tools. As a metaphor, like we can give five painters all the same brushes and paints, and they're going to build something differently. So tell us about clear ketamine plus psychiatry. Like, what's it look like, and what have you built on that end?
Yeah, thanks for asking. So, as you mentioned, my practice is called Clear Ketamine Plus Psychiatry. It's based in Westlake Village, California, which is about 45 minutes north of LA, the city, still technically in LA County, right on the border of LA and Ventura County. So I do both psychiatry, so medication management and therapy, as well as ketamine assisted therapy. And so the model that we use is we do therapy with every patient along with ketamine. So actually, at this point, I'm doing all of the treatments myself, right? So I do the initial psychiatric evaluation. I do the preparation therapy. So we'll do a session of preparation before the actual ketamine treatment with no ketamine, just talking about things like intentions, things like your goals for treatment, preparing you mentally, emotionally, and answering any questions, getting you ready for the treatment to really go into it with the right mindset. Then we do the actual first ketamine treatment. And so I can kind of go into details about how I do that if you'd like. But generally, uh, it's it's an hour and a half time period between an hour and a half and 2 hours in which we administer an intramuscular dose of ketamine starting at half a milligram per kilogram. And we also try to make, I mentioned the mindset before going into it. We try to make the setting extremely healing and therapeutic, right? So there'll be things like an eye mask, noise canceling headphones, a blanket, aromatherapy, things like that. We'll even do with every patient, I do a mindfulness exercise prior to going into the actual ketamine experience. But like I said, we can go into more details about that if you'd like. Then after the day after the first ketamine treatment, we'll do another therapy session. So just me and the patient. And for the actual ketamine session, we'll do some brief preparation and integration, and I'll be there the whole time monitoring blood pressure, oxygen, just in case anything were to go wrong, and even just for gentle support, right? And so then after we'll do another therapy session, right? So just integrating, making sense of the experience, talking about what they felt, how it integrates with what they were trying to get out of it, and how it integrates with moving forward, right? In their goals. So then we typically do, our sequence is 6 treatments over the course of 3 weeks, so twice a week. And then we'll do at least one more final therapy session. So it's a little bit different than the way other people do it, requiring that therapy along with the ketamine. And having me as being a board certified psychiatrist to do both at the same time is a little bit unique. So that's what we do. So we do ketamine treatments and psychiatry. And so, yeah, I hope I gave you a good overview.
Yeah, that's
Yeah.
really cool because I know some other clinics, that are not run and owned by a psychiatrist. They will, either outsource it or have someone else do it.
Mhm.
So, for example, at my practice, I would have a referral network of psychiatrists, psychologists, someone who was different than me, and they would provide that post ketamine, session. But I really love how you're able, you're doing it you're on both sides of it. You're able to provide it and then also do the psychotherapy, psychiatry session post ketamine treatment. So what are some of the things you're noticing? Like, so, someone comes in, let's say they're on number 3 or 4, they're, let's say, 2 weeks in out of those 3 weeks. Like,
Mhm.
what are you seeing with those psychotherapy and please forgive me. I don't know if you refer to it as psychotherapy, but like not
Mhm.
the
Mhm.
ketamine session, but the day after or 2 days after or
Yeah.
whenever you do it. Like, what are you noticing in those patients as far as the discussions without getting into personal details, like just so many themes that you've noticed in the patients post ketamine treatment?
Yeah. Yeah. Thanks for asking that. I I love what I get to do and see, right? So people who, your practice called Reset Ketamine, right? And that's truly what is a great name, right? Because it it's a what I tell ketamine is it's like a jump starting a car, right? Like if your car is not working, you can't turn it on, you can't get it to go. Ketamine itself, even without therapy, can help get you going, right? Improve your mood, decrease the suicidal thoughts, improve motivation, improve clarity, and get you some energy, right? But to keep that car going, you need to do certain things like put air in the tires, get a tune up, change the oil, right? Keep it going, right? And so the therapy really helps with that. So that's why we set intentions and goals, right? So we look at intentions as kind of a internal emotional and psychological state you're striving for. So people can say things like motivation or self-love or forgiveness, right? They're kind of more qualitative themes, really the reason why you're coming there, right? Joy, I want to experience more joy. And then we set goals, right? So in CBT, we talk about something called SMART goals: specific, measurable, achievable, relevant, and within a certain time frame, right? So it's much more specific. So things like within a month, I want to be going to the gym 3 times a week, or I want to be cooking dinner for my family twice a week, or I want to, right, not call out of work for a month, right? So things that are measurable, achievable, and relevant, right?
Functional
So
outcomes as
functional
well.
outcomes,
Yep.
right? Exactly. And so I find in these therapeutic sessions, right, it's people that have been stuck for so long and been hitting a wall for so long start to exemplify and experience, and it dawns on them these intentions like, I listened to a song the other day and I like felt it for the first time in a while, like I used to feel a song, or I was outside on a sunny day and heard the birds chirping and was able to experience that joy. Or like, you know, I was in an interaction with someone and I didn't have that voice of self doubt. I was able to express myself and experience the love in that moment, right? So those are some of the things, the ways that you can see it. And then on the goal side, people will people will be like, I went to the gym the other day for the first time in months, or man, I went to the grocery store and started cooking and like getting started on these goals, right? And then as you progress, more functional, feeling those feelings they want to feel, embodying those states they wanted to embody, achieving their goals. Then you set new goals and you keep progressing and moving forward, right? So that's generally the nature of therapy and what you see. And I mean, you've seen it, right? Ketamine is an amazing medication, and we know the mechanism, right, to induce neuroplasticity, induce a state of being more open to change. But it's truly amazing as a catalyst to assist with that. And so um, that's what we see. And it's just, it's, I'm, I'm repeatedly surprised and amazed at the power of ketamine when used in conjunction with therapy, right? So it's it's really amazing. I guess
Yeah.
that's all I can say. Yeah.
Yeah. I think what you're really highlighting for me is, the ketamine is one aspect of it, and it may
Mhm.
be the catalyst or the reset or the jumpstart. And taking the actions and doing the homework post ketamine, which it can be challenging if someone is in a severe
Mhm.
state of depression. They're like, I just don't feel like exercising or I don't feel like having that conversation. But
Mhm.
once they do get a boost of that motivation and energy, they're like, okay, I am going to go to the gym or have that conversation or whatever it may be, or, go to work or brush my teeth or take a shower. Like, I think in a way it can lead to a positive upward
Mhm.
spiral. I know we talk about negative downward spirals, but all at the same time, if there's negative downward spirals, we know that the opposite can be true and there can be positive upward spirals where then they start working out twice a week or 3 times a week and then now it just becomes a habit where it's like brushing the teeth or it's like we have our daughter, and when we first started, I don't know, brushing her teeth, she hated it. She was always resisting it and fighting it, and then now that we're doing it on a regular basis, she's like, "I have to go brush my teeth." And, in a way, I'm realizing that ketamine can be that catalyst. It can open those critical learning windows that we just naturally have when we were a kid. And then now we can reopen that window, which is what Dr. Goldolan mentioned. And we've talked about her on other episodes, but it's like, yeah, it can open these critical learning periods in the brain so that the person can now input in these healthier habits. And it's a bit easier potentially too once those windows of learning are open.
It's funny you say that. I mentioned those spirals, those cycles to all my patients, right? Like, to your point, you nailed it on the head. All that's needed is that crucial window of willingness and openness, right? And ketamine can help with that. And then to get yourself into that upward cycle, it builds on itself, right? It's a self-perpetuating upward cycle of, like you said, exercise, diet, you feel better, you connect more, you send a text back to that friend group, you go to that social outing, you know, you it, it's just an upward cycle. Whereas that most people come to me when they're stuck in a downward cycle, right? It's they want to get out. They can't get out and get out of bed. They can't. It's overwhelming to respond to someone in a text message or go see friends. People might turn to substance use, right? And then that perpetuates the low mood and staying in isolation. And so, yeah. I mean, that's what ketamine is good for, And I, a, hu- a huge part of it, and if you don't mind me changing gears for a second, and a huge part of my mission is to bring ethical, evidence-based care to the space, right? And a lot of people have a negative stigma, right? They see ketamine as a, you know, um, a drug of abuse, a substance that is dangerous, uh, kind of maybe even a snake oil, like over promising of a new age type of a treatment. There's all different types of providers and ways of obtaining ketamine, some legal, some illegal. We've all seen news stories and horrible outcomes for with the highlighted word ketamine in it. And so a big part of my mission is to explain to people and bring care in a way that is according to the evidence, the safety protocols, and really use it for what it can be used for, educate people on its limitations and what it can do, what it can't do, and how it fits in as a tool to a bigger picture of exactly what we're talking about, potentially medications, therapy, lifestyle. And so I think it's really, really important. It's a life-saving treatment, right? I don't think that's hyperbole to say, right? It is a potentially life-saving treatment. And there is the risk that people will be turned off to it or not have access to it or not consider it because of this stigma and because of this bad interpretation of what it is. And so I think that's really important too. Right?
Yeah. Yeah. And I think the stigma is there, and I totally agree with you. And one of the cool things that just came out recently is, and you probably have heard about this in France, the healthcare system, the government has now approved of intravenous racemic, so generic ketamine, as an anti-suicidal treatment. It's in the hospital, inpatient setting, et cetera. But I'm like, all right, this is a big deal. Like, there's a government who's reviewed the evidence and says, hey, let's use this in these acute suicidal crises to prevent and to save a life. And I think for me, that's when I see that, like 8 years ago, 10 years ago, like that would not have even been possible. But now we have a full country, France, saying, hey, let's do this. And I think that's just really gratifying and makes me feel hopeful.
Me too. And it is changing, right? It is changing. People are starting to understand it's not just a recreational substance to get high. It's a legitimate medical treatment, right?
Right. When
So
used
it is changing.
appropriately and ethically.
Mhm.
Mark, I'm curious. So let's say there's someone listening, and let's say they're a psychiatrist, um, or another specialist, and then they're like, yeah, what's one piece of advice you would give to a clinician who has not opened up a ketamine clinic, but who's just kind of on the fence and thinking about it? Like, what's one piece of advice you'd give them? And maybe, like, in addition, one mistake you made that someone
Mhm.
else could learn from.
Yeah. It's a interesting question. I'd have to think about that. What is one piece of advice I'd give someone that's thinking about starting their own private practice? My first piece of advice the main one piece of advice I'd give is talk to other people that have done it, right? Listen to what their experiences have been. You can avoid a lot of personal mistakes if you and you'd be surprised at how many people who have started their practice are willing to discuss it with you, because they want you to avoid the mistakes that they made, right? So I talked to a lot of people who started their own practice. How did they do it? How are other people doing it? Do you accept insurance? Do you not accept insurance? Do you what type of space do you need? How much space do you need? What type of marketing do you do? Right? There's so many different things you can learn just by asking and observing. So that would be my main piece of advice. Um, Another thing that comes to mind is that it's a marathon, not a sprint, right? Um, you don't, we all have. It's a lovely idea to think you'll start a ketamine clinic or your own medical practice, and right when you file for your S corp or you open your doors, it's going to be you're going to save the world and make $1 trillion doing it. But that's not usually the way it goes. That's usually not the way most great things go. You you have to really be committed to it. It's a long-term investment, and but it's a worthwhile one. At least for me, it has been. So that's the main piece of advice. Pitfalls. Let me think on that. Um, it's so interesting because I even the things that I've that I've spent time and money on that haven't come to fruition. I don't I so value those experiences. I've learned something from them. It's like the tuition of life, right? We go to tuition, we go to medical school and college, and we pay tuition to learn things. But when you start your own practice, when you are doing things, you pay tuition of life to learn lessons, right?
I really love that. I mean, maybe these are not mistakes, but rather, like you just said, Mark, maybe this is the tuition that one pays and that there's always something to be gained. Whether, hey,
Hmm.
did this, chose this wrong vendor, or, maybe didn't do this. It's like there's still a lesson to be learned. And
Hmm.
yeah, that is the tuition. So I love that reframe and how you view these quote mistakes. And even just the word mistake, maybe it's not a mistake, but actually just a learning to gain a nugget of
Yeah.
knowledge from.
So the one I came up with is know your limitations and outsource. Like find good people who have strengths that that can that are good at the things you're limited at, and uh, pay them to do it or hire them to do it. Things I realize that accounting, for instance, for an S corp, it is not my strength, and they accountants have a job for a reason, right? Answering phones, certain marketing, right? These let the experts do their thing, just like they
Hmm.
let us do ours, right?
Yeah. Yeah, definitely delegate and outsource what we're not good at or what we don't want to spend a ton of time getting good at. Uh, Mark, the sun is setting on the conversation, and I want to start landing the plane. So I have some fun
Sure,
questions for you.
sure, go for
And
it.
so let's see. First question is, what is one book that you've really enjoyed reading in the past year or so that has had nothing to do with medicine?
I read this book. I'm sure you've read it. It's called *Sapiens*, and it's basically about the entire story of human history from way hundreds of thousands of years ago when Homo sapiens first started, and the progression throughout time of the agricultural revolution, the industrial revolution, the cognitive revolution, and just how we became to be in this place right now. And truly, how amazing the time that we live in right now is in the entire course of human history. It's the rate at which we're expanding technologically and in so many other ways is more than a exponential logarithmic curve, right? It's truly amazing. So highly recommend that book. Very interesting. Puts things in perspective.
Yeah, I've actually read that book a couple of times. It's yeah, just a lot of insights in that one. Okay, so next question is, let's say you have one last meal, the final
Mhm.
meal for Marc Smith.
Mhm.
What's the one meal that you're going for?
This is an interesting question because I accepted a challenge for the month of May for vegetarian, and I haven't been eating meat. So, eh, that said, I if I could have one meal, I recently took a trip to Japan last year, and I went to this place. It's called the Outer Market, and they have sushi. They have fish that they bring in off the boat, and you can get that like first batch of fresh fish. And I would just get the toro and the salmon from that. I would just get a massive amount of it and just absolutely crush all of it. It's my favorite meal. It was
Oh,
probably my favorite meal of my
oh,
lifetime.
man, that sounds so good. Okay, Marc, after a long day at the clinic, and work, what's your go-to way to relax and de-stress and chill out?
I recently picked up pickleball, and you really need to be careful with pickleball, okay? Because you'll find this with many people. You pick it up and then all of a sudden it's like all you do. You're online looking at different paddles, you're buying ice things to ice your knees and joints, you're stretching, you're doing workouts, you're playing 3 hours a night. So if I'm not in the clinic afterward, you can find me on the pickleball court. And
Wow,
I'm getting a little better. I'm getting a little better, but still a long way to go.
that's awesome. It's become the pickleball has become the way of life. It sounds like it
It
can be
is. There's
all
a whole
encompassing.
philosophy to it. Exactly, exactly.
That's that's awesome. Okay, so time traveling question. If you could go back in time for a day, where and when would you go and why?
So I lived in New York City for 10 years, and for some reason, I this is a funny story. I had to, in my post-bac pre-med, one of the things I had to do, I as part of the prerequisites, I, for some reason, had to take an like an English, like a liberal arts English course as part of the requirements. And I took this course. It was about Walt Whitman in New York City, and so I learned all about uh, New York City in the mid 1800s, and it's kind of like the time around gangs of New York and that kind of era. And for some reason, I just find that so fascinating, like Civil War era, before and after that time, when they were building the Brooklyn Bridge, all the different immigrant populations. It was just such an interesting time in New York City. And, you know, I, I always would have loved to experience what that's like. Now, that said, there's a lot of negatives that we ignore. For instance, there were horses around the streets, and it wasn't exactly the most cleanly place to be in the world. But to just for a day, I'd like to go back and experience New York City in the mid 1800s.
Yeah, that sounds like a fun time, a really interesting time because there was a lot of growth. I mean, and building that was happening. So that's remarkable. All right, a few more questions. Let's see here. Okay, this one might be tough, but you can feel free to skip it or not. But let's say you could not be a physician, and you, as a matter of
Mm,
fact, you can't do anything in the healthcare space. What career do you think you would do instead?
that's an interesting question too. It's so hard to say that. I mean, that's such a hard question because I truly can't imagine doing anything else. But if I had to, if my feet were held to the fire, I think I would probably be a journalist because you're able to kind of do deep dives into different subjects or learn a lot while, you know, while how do I put this? You'd be able to learn a lot about a lot of different things in a deep way and talk to learn about the human condition as well and just humanity as a whole. So that would probably be what I would do.
All right. Two more questions for you, Mark. What advice would you give to your 20-year-old self? So this is not for anyone else, but Mark is able to give, current Mark is able to tell 20-year-old Mark one thing or lesson or advice. What would you tell yourself to the 20-year-old version?
Hmm. You asked very thought-provoking and interesting questions, Sam. Um, I think I would tell myself that not to be so afraid, right? All those things you're afraid of, I think an we have a negative attribution bias. Like, so evolutionarily, people talk about this, right? You, if you see a bush that's shaking, it's evolutionarily and it's a survival benefit to assume that that's a lion rather than, even if 9 out of the 10 times it's the breeze or a bird, right? And I think we can all relate to this. Like, even going into a career that was seen safe or lucrative or was kind of the path of least resistance for me. Um, I ultimately, like we talked about at the very beginning, to come full circle, I did take that left and fight my fear. But you know, I think our imagination of what's possible for us in our lives is so small, right? We can't imagine the reality of what could be, and we can't see what's going to happen. So just to not be listen less to that voice of fear and more to the voice of possibility.
Wow. Beautifully stated, Mark. I really appreciate you for saying that. And yeah, I think, well, I guess I'll ask two more questions as we wrap up. The first one is, where can people learn more about you, your clinic, if there's any patients or clinicians? Like, is it the website? Is it the socials? How can people learn more about you? And then the final question will be, do you have any other last thoughts, comments, anything else that you really want to highlight or share as we wrap up the convo?
Yeah. So if you want to check out my practice, learn more about me, you can certainly go to my website. It's www.clearketapsych.com. That's ClearKetapsych.com. I'm on Instagram at clearketapsych. I'm not on TikTok, but I am on Instagram. Marc Smith MD. I'm also on Instagram personally. Um, and yeah, I'm on LinkedIn, all the socials, but best way you could also just do a Google search, clear ketamine plus psychiatry. I think I'll come up.
Excellent. And we will put those into the show notes. So if you're listening in your car, don't have access to a pin, you can check out the show notes because we'll put all of Mark's links below in the show notes.
Thank you. Yeah. And then just the last thing I'd like to say is thank you. Thank you for having me. Thank you for the work that you do. I've already talked about, how I think the work that you do is really important. And, I just that I'm so grateful to be a part of this new field and linking up with other providers and clinicians that expand access to this life-saving treatment in an ethical and evidence-based way. And yeah, I'm excited to see what continues to happen and keep working on it. So, good for you and keep this going too. I appreciate you.
Mark, it's been a pleasure talking with you, connecting, getting your perspective. I'm so grateful to have you in our community. I consider you not only a colleague, but a friend, and I really appreciate all the work. If I had any patients, and actually do, who are in that area, you're definitely one of the top physicians that I recommend absolutely coming to you, because I know you hold the space and you work with such high ethics. So appreciate all the work you're doing. And seriously, it's been a fun conversation. Thank you for being here, Mark.
Thank you.
Thanks for joining us for the inspiring conversation with Dr. Marc Smith. His journey from finance professional to psychiatrist demonstrates that it's never too late to pursue a life of purpose. His integrated approach to ketamine therapy shows what's possible when providers prioritize patient care alongside business success. If you found this episode valuable, we'd really appreciate it if you can leave us a review on Apple Podcasts or Spotify. It helps other medical professionals discover these important conversations and grow our community of practitioners. For complete show notes, including links to Dr. Smith's practice at Clear Ketamine and Psychiatry and other resources mentioned, visit ketaminestartup.com/podcast. And remember, this podcast is for educational purposes only and doesn't constitute medical or legal advice. The approaches discussed reflect individual provider experiences and should be evaluated with your own practice context and regulatory environment. Thanks again for listening to the Ketamine Startup Podcast, and we'll see you in the next episode.